Doctor, I'm sorry. Okay. Yeah. Yeah. As I said, she's the Associate Director for Minority Health and Health Disparities Research at the Georgetown Lombardi Comprehensive Cancer Center here in Washington, D.C. She is an internationally known researcher with dozens of journal publications, and she's the first African-American woman to be awarded a doctorate in epidemiology in the United States. In addition to her research accomplishments, Dr. Adams-Campbell is a true mentor. As the former director of the Howard University Cancer Center, she has mentored young researchers who are now well entrenched in the international research community. And as a researcher who's nationally known, I'm proud to say that I'm an example of her commitment to recognizing and supporting those willing to work hard and to continue to learn. Dr. Adams-Campbell.
Good afternoon. Hope you get through your lunch fast. But anyhow, this is the education part about clinical trials, and you're going to hear from a couple of doctors talking about that. But I think we've had great conversation this morning about clinical trials. So there seems to be a fear of clinical trials, but I think most of it is a lack of knowledge. People have not been educated about the importance of clinical trials. For all the women that wear makeup, trust me, it's all been tested in clinical trials, starting with animals. So clinical trials are important, but when it comes to humans, we are so well protected for ethical reasons. And I think it's very important that you understand that we all can participate in some form of clinical trials. Today we're talking about multiple myeloma, and there'll be clinical trials available that they will discuss about the multiple myeloma and also other hematological cancers such as lymphoma and leukemia. But there's this whole spectrum of clinical trials. Prevention studies, somebody mentioned nutrition, diet. There are studies that go from prevention all the way up to disease. And once people have a disease, to keep it from recurring. So don't think about clinical trials just solely when you're really sick and you really need it. That's definitely a priority. But there's many trials all along the spectrum from prevention to getting people to stop smoking, something so simple as smoking. We can do clinical trials. And when they talk about generated by machines, you randomize based on a number, it's a very cold way of saying it. We just want to make certain there's an equal distribution of people in each of the arms. And when we talk about treatment trials, you have to understand that you will never be given a placebo in a treatment trial, and you will be given the standard of care, which is the least of the optimal drugs, to maybe a new drug that's come out. So people have a fear that they're going to be a guinea pig being experimented on, and they're not. They're given either the standard of care, what we already know, or that plus something else. And sometimes if you take one drug first and another drug second, if you flip the order, that could make a major difference. They kind of test those types of studies as well. So I just want you to have an understanding that we could do a whole seminar or workshop on clinical trials, and I bet you we find something that you would be interested in participating in. So we're going to move on right now to our first speaker. Oh my goodness, I get a challenge with the name immediately. Dr. Pendle Pally. Dr. P. She's going to talk about the ABCs of lymphoma, leukemia, and types of clinical trials and what they do and what they don't do.